Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! We've all heard about rehabilitation after a surgery or after an injury or even a traumatic event. But what about PREhabilitation or PREhab with a PRE? Well, that's a concept that is getting a lot of attention lately. It refers to preemptive conditioning, both mentally and physically, before a surgery in hopes of reducing the recovery downtime afterwards and reducing risk of complications. How does it work and what's involved? Well, that's where Dr. Rebecca Knackstedt comes in. She has championed PREhabilitation in her plastic surgery practice, and in our conversation today, she reveals some interesting insights about benefits of this relatively new concept. Let's go to that now. Well, today we are lucky to have Dr. Rebecca Knackstedt, who is a board-certified plastic surgeon and assistant professor at Duke University, having completed her MD PhD at the Medical University of South Carolina and a microsurgical fellowship at the Cleveland Clinic. Now, she is an accomplished clinician and researcher with interests in, among other areas, our topic of the day, PREhabilitation. Welcome, Dr. Knackstedt.
Thank you. I'm super happy to be here.
Oh, great. Well, as we begin, could you tell us where you practice and what types of patients you see? What types of cases do you typically do?
So I am a plastic surgeon at Duke University, and the majority of my practice is breast reconstruction after cancer, and I also do a fair amount of gender affirmation surgery.
Very interesting. A nice variety of cases you must do. Well, let's just get right into our topic today. What is PREhabilitation, and how is it different from what we already understand as rehabilitation?
I think that most of us have probably heard the term rehabilitation at some point and maybe even have done an aspect of rehabilitation. Rehabilitation is something that happens after a surgery, after a chemo, after an injury, versus prehabilitation is doing all of that training and optimizing your body and exercise before something. So before a surgery, before chemotherapy, in order to optimize your body and allow for recovery.
You know, I think to a lot of people, it's a really novel concept. We don't really, think about things that way. We're often reactive rather than proactive. And yes. I wonder, since it's going to be new to a lot of the listeners, how long has this concept actually been around?
Interestingly, it was first reported back in the 1940s in the British Medical Journal.
The 40s.
Right? In the 40s.
Yeah.
And it was an approach used to prepare military recruits. So optimizing them before they went off to battle, looking at their physical fitness and their mental well-being.
Yeah.
And then it kind of disappeared from the literature until the 1990s and 2000s, and prehabilitation re-emerged, and it was used for patients who were undergoing lung resection. Before the lung resection, they would do breathing exercises to help their breathing after surgery. And since then, over the last 20 or 30 years, it's really been shown in multiple surgical disciplines how effective it can be.
You know, you mentioned the battlefields in war, and surgery can seem like a battle type injury to your body. And
Absolutely.
it does make sense to try to prepare and get ready for that so that you can weather it a little bit better. So, yeah. Well, as we talk about prehabilitation, what can prehabilitation actually do for a person? Does it minimize complications during or after surgery? And if so, how does it do that?
I think that, as surgeons, we love data, we love
Oh,
science. And
yes.
what I love about prehabilitation is that there actually is science showing that it's effective. There are studies showing that if you prepare your mind and body before surgery, you can decrease your complications, allow you to get back to baseline faster than you would have otherwise, and really just make your surgical experience better and faster. It's preparing your body for a controlled trauma. It's preparing your body for a marathon. And what it's doing, what prehabilitation is doing, is it's building up the tools you need before surgery in order to allow your body to heal better. So building up your protein stores so that you have resources to heal your wound, building up your mental reserve so you have that mental capacity and stamina to bounce back after surgery.
If you are not either physically or mentally prepared for a surgery, or if you haven't done a little extra work to prepare, can that translate into medical complications? In other words, higher risk of infection or prolonged recovery or...
Yeah, all of the above. I think that since studies have shown that prehabilitation can improve all of those different aspects of recovery and healing, the absence of prehabilitation, or pretty much the standard of care in surgery,
Right.
and for the most part,
Let's be honest, yes.
is not giving as ideal of outcomes as you could have had.
Makes sense that it would, but does it allow a patient to become more functional after a surgery a little sooner? Because as physicians, we always tell our patients, look, you can't do these types of activities, for this period of time, or you're just not going to be conditioned or, able to do this kind of thing. Do you find that people are able to do things a little sooner after surgery once they have gone through a course of prehabilitation?
Yes, and there's studies showing that. So specific examples in the breast cancer world, there's studies showing that if you optimize your shoulder and arm function before surgery, you actually recover that function faster after surgery. And that's one of the main deficits we see in women after undergoing a mastectomy.
Yeah.
And that's been shown also in other surgeries. Just looking at the 6-minute walk test, they can get back to their baseline faster if they prepared before surgery.
That's really important what you said about arm and shoulder movement and function, because when you're doing a breast surgery, you're interacting with the chest. There are muscles right under that area. The shoulder joint is very close, and especially if there's been any sort of dissection or surgical component in the axilla or armpit area, there's a tendency for the patient to hold that in. They don't want to hurt.
Right.
They don't want to, injure their incision or anything like that. And so what I hear you saying is that if you have done some work beforehand to maybe stretch out some of the ligaments in that area and maybe even build up the muscles to some degree, how does that translate to what you find afterwards?
Yeah, I think that we forget that actually the majority of women after undergoing a mastectomy have decreased range of motion postoperatively.
I think that's going to be a surprise to a lot of people.
It is. And I think that it's something that patients just experience and they just assume it's part of what was expected. But if they can strengthen their shoulder girdle before surgery, then it can allow them to bounce back faster. And we know how important that is just for quality of life and doing your activities of daily living.
Absolutely. It's amazing how just attention to something in advance, again, proactively, can really make such an impact on the overall outcome. I think that's wonderful. So basically, what I hear is that the stronger you are going into surgery, the stronger you will be coming out of it. As we were saying before, quite often after a procedure, you may feel temporarily weaker, maybe have less balance or stability or even stamina. Plus, we can't forget about the emotional and mental endurance that can be impacted. But you're sort of training all those things so that things would be better afterwards or recover faster?
Yeah, I think that's part of it. And then I think the other thing that we have to keep in mind is what surgery actually is. Anytime you have surgery, it's such a catabolic experience. You are breaking down proteins that are in your body to allow your body to heal.
Mm-hmm.
So it's breaking down your leg muscles and your arm muscles to get those amino acids to heal. So the more muscles you have, the more reservoir you have, you're going to not dip as far into your reserve as you would have otherwise after surgery.
That's a great way to look at it. You're building up your reserves of these chemical compounds, really, when you get right down to it, so that you have plenty when your body really needs it.
Exactly. And the same goes for your mental capacity as well. Surgery is stressful. And if you build up your mental reserves before surgery, it's going to help with all of those emotions and feelings after surgery.
Yes, yeah, I think that's wonderful. And it's a great way to look at it.
Yeah, it's actually perfect timing because there was a huge meta-analysis that was released last week, and it was actually focused on NPR 3 days ago.
Nice.
And it was a meta-analysis. So it was a study that looked at other studies, and it looked at 186 studies with over 15,000 patients. And it looked at any type of prehabilitation, whether it was exercise or nutrition or behavior, stress, anxiety. And what they found was pretty much any type of prehabilitation improved outcomes after surgery, whether it was decreasing complications, decreasing length of stay, improving return to baseline functionality, or just subjective quality of life. It improved those outcomes. And that is the highest level of evidence we have.
That's amazing. And to think that there are that many studies, and yay, I'm glad it's getting national attention. But you're saying that even if a patient feels like, look, I just can't commit, all of this time to doing all this preemptive work, but I could do some. So even that some can make a difference.
Absolutely. And I think that, as healthcare providers, we never want someone just to look for an easy pill to take. It's about lifestyle changes.
Right.
But these studies show that even those easy pills, if that's all a patient is willing to do, can still improve outcomes. And that's really exciting.
Yeah, it really is. I think that's fantastic. Well, let's get into some of the nitty-gritty of what prehabilitation is, because right now we're talking about it like an umbrella term, but there are different components of it or modalities of it. And the first one that comes to mind is sleep. What is really needed in terms of sleep, and how do you treat it if it's problematic? How would problematic sleep, first of all, impact a surgery, and then how do you go about trying to help that before the surgery so that the patient is tuned up, if you will?
Yeah, good question. I think that most of us have bad sleep.
Oh, I think that's true.
I think we can agree on that. But especially if you have a new cancer diagnosis, or you're stressed out about your upcoming surgery,
Sure.
or you're just finishing neoadjuvant chemo, studies have shown that your sleep is even worse than the general population.
Mm-hmm.
And then you have surgery. And I think the important thing to remember is that every aspect of surgery negatively impacts sleep. So general anesthesia impairs with sleep. Taking narcotics impairs sleep. Pain, the LED lights in the hospital, the sleeping restrictions we give to patients, all of these things just destroy sleep. But why do we care? Because sleep is so important to heal. And studies have shown that even just one bad night of sleep, which we've all experienced in residency and just life,
Oh, sure.
has such negative metabolic implications. It distorts your blood glucose. It gives you high blood glucose. It makes you crave sugary food on top of that. Mm-hmm. It increases how much pain you feel and actually makes you want more narcotics.
Oh, interesting.
So all of those things, surgery is negatively impacting sleep so much, but on the flip side, it's so important to heal. So we need to really get your sleep hygiene set before surgery and really optimize it before surgery. And studies have shown that there's a lot of low risk potential reward things you can do. Things like yoga, acupuncture, exercise, melatonin, all of those have actually been shown, especially in the breast cancer population, to improve sleep even before surgery.
Oh, gosh, this is great. So, as an example, someone might do a little bit of restorative yoga before they go to bed or before they want to go to bed, and that might kind of get them on track to maybe fall asleep a little sooner and maybe stay asleep a little longer, as an example.
Perfect. Yes. And just having that tool in your toolbox for when you're having bad sleep after surgery, having a meditation practice
Oh,
is really
yes.
helpful.
Yeah, that's a great point. That kind of segues kind of right into stress and anxiety and treating that before surgery. Relaxation techniques, meditation, what kinds of things can impact stress or anxiety? Of course, a lot of people are anxious before they go into surgery. That's normal. But what can be done to sort of tamp that down a bit?
Yeah, especially as someone who does a lot of breast reconstruction, that patient population has so much stress and anxiety, which you can imagine. And so I see it all the time. And I think it's similar interventions to sleep. It's things like meditation and yoga, cognitive behavioral therapy. Those things can all really help manage stress and anxiety. But it's really important, once again, to get those tools in your toolbox before surgery to help with all of the additional stress and anxiety after surgery.
And so having good peace of mind before surgery can be helpful, I'm hearing you say. And I wonder if a patient having a really good understanding of the procedure and the expected outcome, and also even participating in the decision-making process before surgery, do those things kind of help mentally prepare the patient for the surgery, kind of like they have agency over their course of treatment?
Yeah, absolutely. I am all about empowering patients, not only for the informed consent and the shared decision making that we're doing, but also empowering them to take control of their recovery and to do all of these things before surgery. I think as surgeons, we often feel like we're overwhelming patients. We're giving them too much. But there's actually studies showing, qualitatively asking patients, did you wish you had more information? Did you wish you were told things to do? And the resounding answer is yes. So patients want this information. They want to know how they can improve their outcomes.
And probably it helps when they feel like they have a little more control themselves over the situation. So they decide to do the things that could help prepare them for surgery. That's having a little more control over your life. And I think that probably would reduce some stress or anxiety, wouldn't it?
Absolutely. I mean, I think that one of the biggest concerns that patients have is the episode of general anesthesia. Here's this time that you're completely out of control and
Right.
you're trusting strangers to do surgery on you. So I think that if there's something else that they can control, it can decrease that overall stress and anxiety.
Yeah, that's great. Well, so that kind of carries us into mental health support, especially for bigger surgeries or surgeries that have an anticipated long recovery. If it looks like a patient would really benefit from that, what is recommended or what kind of evaluation might you do on the patient to even see if it's indicated?
Yeah, as a surgeon, that is so out of my wheelhouse, and I should not be counseling patients on that. But
Right.
a benefit of being at an academic center is that I do have people that I can refer them to. And especially for breast cancer population, I really refer my patients a lot for counseling and therapy. And just talking to someone else that's not me, they might feel more comfortable sharing things with a counselor or a therapist than they do their surgeon.
Right.
So I think that option is so important.
Yeah. But as a surgeon seeing so many patients of this type, you probably have gotten to the point where you can recognize a patient who is in need in this area and make the call to refer them.
Absolutely. I mean, it's in the questions they ask, it's in their behavior in clinic and the messages they send you on the computer. You just kind of get a feeling of who would benefit from having someone else to talk to.
Well, it's great that you're able to recognize that and make a difference for them. Well, I'd like to move on to what I'm going to call habit modification. We know that smoking is bad and alcohol use and drug use may impact, recovery around the time of surgery. And of course, stopping smoking can increase stress. So, you're adding a layer of problem there. But what are your thoughts about habit modification?
Yeah, I think that no one is arguing at this point that smoking is bad. But we also know that it's so addictive and it's such a hard habit to stop.
Yeah, what kind of problems does smoking create?
So there's studies showing that just having one cigarette decreases blood flow to your fingers by 40%.
Wow.
And we know that blood flow is so important for surgical healing. So just imagine that type of blood vessel constriction happening all over your body if someone is having multiple cigarettes a day.
Yeah, so your body can't get the nutrition or oxygen it needs to heal?
Exactly. So if you need a surgery and you're a smoker, you still got to have the surgery. But for more elective procedures, ones where we can safely delay it, it's always a good idea to do those types of habit modifications before the surgery.
So, and that may take some time, right?
Absolutely.
I mean, it's not going to happen in a week. Do you have a certain period of time that you want patients to stop smoking before one of your procedures, especially the bigger procedures?
Yeah, I use the cutoff of 4 weeks before and after surgery, which most of us use. It is based on a flawed study, but it's all the literature we have. But I think that 4 weeks shows patient commitment and shows that they're able to do it.
Yeah.
Because as you can imagine, when they're stressed after surgery, the first thing they're going to want to do is have a cigarette.
Exactly. And then alcohol and drug use, what types of problems do those create? Or is it related to healing or anesthesia, or what are your thoughts?
Right. So smoking is more related to wound healing, which is not desirable, but the alcohol and drug can actually be dangerous because of the way that it interferes with anesthesia, your body's ability to detox after anesthesia, and actually can increase how much pain you feel after surgery. So then making you require more narcotics. And if you're requiring alcohol, you can actually go through alcohol withdrawal after surgery, which can be life-threatening.
Yeah, the problems can really compound. And if you are having more pain and you need more narcotics, that in itself, especially the opiates, can really wreak havoc, as I think a lot of listeners are aware these days.
Absolutely.
So that's a great point. Well, let's move on to the concept of social networks. And I don't mean social media. I mean, people's relationship to other people who would hopefully be supporting them through this process. How important is it to have one or more persons that you can rely on during this process? And does it really make that much difference?
That's such a good question. And I think that it's probably the most overlooked aspect of a multimodal prehabilitation approach. But the studies are overwhelming. So studies in breast cancer have shown that if you don't have a strong social support, you're actually less likely to complete your therapy. You have increased mortality after a breast cancer diagnosis, actually on par with smoking for 50 years.
Wow.
So it is a tremendous impact on recovery from surgery, both from a caregiving, someone taking care of you, being there for you, but also just objectively decreasing survival outcomes.
That's impressive. And I think that will probably surprise a lot of people listening to this. So,
Absolutely. It certainly surprised me.
yeah. So social networks are key. Do you have to have a lot of people? Do you need just one person, or what are your thoughts?
Yeah, the studies really haven't gotten that granular, but I think that there's so much misinformation out there on social media, but I think that this is the one good thing that social media is actually good for is, patients rallying around other patients and giving them emotional support, because there's a fair number of patients that they just don't have anybody.
Yeah.
And having that even long distance kind of emotional support, I've seen it in my own patients, can actually be really empowering.
Yeah, so perhaps there are groups of people who have gone through the same surgery and can relate, or maybe there's a network there, or, just someone who is a friendly ear to what you have to say,
Exactly.
can make such a difference, I would imagine. Well, what about exercise and muscle mass? How does that impact surgical outcome and recovery?
Yeah, I could talk about exercise and lean muscle mass all day.
Okay.
I think that that's probably the most important part of preparing your body for surgery.
Ah.
And I think that we have to break it down to two different things. The first is preparing your muscles so that you can functionally perform after surgery.
Mm-hmm.
So, for example, if you're having a surgery that's on your breast and maybe your belly, you're going to be in pain in your breast and your belly. Your surgeon's going to tell you don't move your arms a lot. So you need strong leg muscles to help you get out of the chair, walk around, just function after surgery. So that's kind of what makes sense.
Yeah.
That's more of a just exercise prehabilitation.
Sure.
But the most important thing, and I think the thing that's often overlooked in surgery, is once again, it's creating that muscle reserve that we're going to dip into in order to heal after surgery. And we call that sarcopenia in the medical field, low muscle mass. And sarcopenia or low muscle mass has been shown to increase surgical complications, decrease recovery, increase hospital length of stay. Because once again, you just can't bounce back as fast. You can't move around and you don't have that reservoir to call upon in order to allow your body to heal.
I think that's just fascinating, and I think that will be new information for a lot of people listening who haven't really thought about it in those terms of needing a reserve, so to speak. If you have the luxury of this before surgery, and now not everybody does, but if you do have the luxury of preparing your lean muscle mass and preparing your body exercise-wise prior to surgery, what do you usually recommend, or what would be an example of what you might recommend for a patient?
Most studies that have looked at prehabilitation from an exercise standpoint use some combination of resistance training and cardio. So it's improving your lung function, improving your respirations, but also building muscle, which is nutrition is also super important for, but probably a combination of cardio and resistance training would be the most effective.
And then for a certain period of time, or
most of the studies that have shown an actual improvement used about 4 weeks before surgery.
Gotcha.
And interestingly, a lot of them were done during COVID, so it was all done via telehealth.
Oh my goodness.
So we know that we can even do it remotely and still be very successful.
Oh, that's so interesting. Well, you touched on nutrition. Let's talk about that. Now, in my podcast, we've had a previous episode, number 98, that is completely devoted to perioperative nutrition, meaning nutrition before and after surgery. But I would like to know your thoughts on nutrition as part of the prehabilitation process. What do you think?
Yeah, when I was first thinking about what prehab meant to me and how I was going to talk to my patients about it, I was honestly just focusing on nutrition. And then over time, I realized that that was not comprehensive enough, but that's really where it all began for me.
I see.
And I think that if I would just have one take-home point, it's that no one's eating enough protein. Every patient needs more protein than they're eating in order to adequately recover. But it's such a nuanced message. It's not just grams of protein. It's animal versus plant, incomplete versus complete, leucine content. So I think that that is something where I'm not all about tracking macros and micros, but it actually is a good idea. And I encourage my patients to track their protein before and after surgery.
So should patients be consulting with a nutritionist, a dietitian before surgery? Is that helpful or is that required? What do you think?
Yeah, that's a difficult question. And I think the first thing to keep in mind is what someone's credentials are. So if someone is a dietitian, that means that they did certain schooling, they passed certain exams, they are licensed by a board that governs them. Pretty much anyone can call themselves a nutritionist, and definitively anyone can call themselves a health and wellness influencer. So if you're getting your information from social media, that it's just really important to keep in mind what someone's credentials are and what their training is. I think the other challenging thing, though, is that I see so much posted on social media that's kind of old nutrition advice, things that were probably taught 10, even 5 years ago. But you really need to find someone who's up to date, keeping in touch with the literature, because our nutrition understanding is truly changing very, very rapidly. And we need to take that cutting edge evidence-based information and pass that along to our patients.
Oh, I think that's great. And it's really helpful to clarify the credentials of someone who is giving advice. Well, I'm curious if a patient is going to have to stay overnight at a hospital, is there anything that they should bring with them to help with sleep or nutrition or stress in that early recovery period?
Yeah, I think we can break it down really into 3 categories: things to make you sleep better, things to make you relax, and things to eat. So things to make you sleep better could be things like noise-canceling headphones, an eye mask,
Oh, great ideas.
comfortable pajamas, a pillow, blanket, anything that makes you feel more comfortable. Things to relax. If you have a room that is alone, you could actually bring in an aromatherapy diffuser with lavender. Been shown to decrease anxiety, improve sleep. Pictures of loved ones, anything that makes you feel more at home, more relaxed.
That's nice.
But I guess the first question is whether or not you have a single room so that you don't offend your sleep
Right.
mate with your lavender scent. And then I think the last thing is things to eat. I think one of the greatest sadnesses in our healthcare industry is the food that we serve in hospitals. And so I
Yeah.
always tell my patients, if I know they're going to be in the hospital for more than one night, I tell them to bring their own whey protein powder if they're open to that. And I've actually had patients bring their own blenders in and they make a little yogurt protein smoothie in the morning. So
You're kidding. I love
if
that.
you're motivated and you have a little blender at home, it's a great way to get nutrient-dense food and not rely on what the hospital's serving.
Oh, gosh, that's wonderful. Very good. Well, so if a person is going to spend the night at the hospital, whom should they have with them? Do they need to bring somebody with them?
I think it's great if they can have someone with them. It's so nice, one, just to have a support person there, someone to, ask to help you with things if you need help, but also just someone there for emotional support. As we know, hospital rules are always changing post-COVID with whether or not patients are allowed to have someone stay overnight.
Right.
But if they have a family member or loved one that could stay overnight, I think it's really nice to have that support early on.
Yeah. I'm sure that's comforting to a lot of people. Well, as we talk about prehabilitation or prehab, there's so many different aspects we just went over, but how much time should someone devote to this before surgery? And I know you don't always have the luxury of planning that out because, sometimes with a cancer operation or, something that you find out about relatively a short time before the planned procedure, you can't always prepare. But if you do have the luxury of preparing, how far in advance should people be thinking about these things?
As much as they can.
Okay, fair enough.
It depends on the type of surgery. For a lot of my autologous breast reconstruction patients, which is a big surgery with a long recovery, autologous means using your own body to create breast. So we actually can use abdomen or thighs or back to create a breast. And it's a natural form of breast reconstruction. But it's a big surgery, it's a long recovery, and sometimes they're scheduled really far in advance, 9 months to a year in advance. And in those cases, use your time. I've had a patient actually get a bike covered by her insurance company because she said that,
Really?
yes, it's amazing. I wrote a letter of support. They paid for her to have an exercise bike because we showed evidence that exercise before surgery could improve her recovery. She got it covered.
Oh, nice.
So that's awesome. But
Yeah.
I think that the encouraging thing is that there's studies in head and neck reconstruction that just 5 days of just nutrition optimization before surgery can improve outcomes. So use the time you have. Even 5 days can make a big impact.
That's impressive. 5 days worth can really make a difference. Words to live by.
Absolutely.
Well, is there anything else that we could consider part of prehabilitation that we haven't hit on yet?
Yeah, I would just mention pain control.
Oh, let's talk about that for sure.
As surgeons, we're so good now at decreasing postoperative pain with our enhanced recovery protocols and our strategic nerve blocks and all of the different pain medications we use. But interestingly enough, there's now studies coming out showing that the number one predictor of how much pain people feel after surgery is how much pain they think they're going to feel and how much pain they have before surgery, which is shocking.
Yes.
But, that just means it's something else that we can intervene on. We can do things like cognitive behavioral therapy and managing stress and anxiety and fear to decrease their post-operative pain. And studies show that if we can decrease the pain they feel after surgery, we actually decrease their chance of developing chronic pain, pain that lasts months after surgery, which, as you can imagine, just really impacts quality of life.
Oh, surely. So is part of what you might do preparing the patient for the degree of pain? In other words, if they are anticipating a lot of pain, how does that affect them? Or if they breeze into it thinking, oh, this will be a walk in the park, and they're not prepared. I mean, can you give us an idea of how those scenarios might play out?
Yeah, absolutely. And patients ask this all the time. How much pain will I feel after surgery? How many days will I need narcotics for? And for most patients, it's a bell-shaped curve, where some have little to no pain and some have a lot with the same exact procedure.
Mm-hmm.
But I think that this can actually be one of the good uses again for social media. So talking to people who've had this surgery. I didn't have this surgery.
Mm-hmm.
I can tell them what my patients tell me, but I think that that's a really good resource to talk to other patients that went through that same exact surgery.
Yes. So preparation for the level of pain is key, really.
Yeah, and just setting expectations.
Yeah. Well, these days, as we physicians are starting to think about the bigger picture for treating our patients, planning for prehabilitation is one example, and not just focusing on the procedure alone. What might you see on the horizon, or if there is something that you would love to see in terms of advances being developed, what are your thoughts about that?
I would love to see insurance cover prehabilitation.
Yes.
I think we all have our problems with insurance companies, and it's so frustrating to me that as a surgeon, I can get nutrition supplements approved after surgery for my patients, but not before surgery, the same exact supplements. And, it's money and it's investing in the patient before they've even had surgery, but there's studies showing that prehab, even though it costs more money in the beginning, actually saves money in the long term because patients have decreased complications. They stay in the hospital less. They don't go back to surgery for complications as much. So I think just showing more studies, getting more evidence that we can then give to the insurance companies, that would be game changing.
Oh, that would make a huge difference. And I think that would give a lot of patients peace of mind. It also lends a little more respect or credibility to the concept of prehabilitation, that even the insurance companies have recognized the importance of this, the value of this tool to prepare a patient for surgery and reduce the risk of problems in the outcome. I would think that would just make a tremendous difference. So.
Absolutely.
Great. Well, Dr. Rebecca Knackstedt, you have just given us so much information, so many great ideas and things to think about. Are there any final thoughts you'd like to leave the listeners with, about our subject today or just about plastic surgery in general?
Yeah, I think the take-home message for anyone listening should really just be one of empowerment. So much of surgery is overwhelming and stressful, and patients have so much anxiety, but there's so much that you can do as a patient to positively impact your surgical outcomes and your overall experience. And I hope it's not stressful. I hope it's empowering, and patients make even just one little change can really make a dramatic difference. And I hope that this encourages surgeons to talk to their patients about these topics too.
I love that. And those are some wise words. Thank you so much.
Thank you.
Really appreciate you sharing your time with us today.
Well, thank you so much for having me.
Take care.
You too.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.